did you find your experience with chemo?
Initially, not great, but after 1-2 rounds, I felt brilliant because I knew something was happening, something was killing it, something was shrinking it. You know, and when you see the numbers going down every time you go to chemo, that you know just gives you more confidence to fight.
So encouraging, isn't it? For me, the actual day of having chemo was fine. I felt better at the end of the day than I ever anticipated. Then you'd have 48 hours of sort of feeling increasingly tired and groggy. You're taking the steroids, which can make you feel a bit shaky. And then day 3 and 4, I'd feel pretty low, just very, very sleepy and tired and a bit under the weather. But then it would start to pick back up again, sort of day 5, 6. I had leg aches, but other than that, I didn't have any nausea. You know, I felt I was really, really fortunate. You know, the side effects from chemo were actually quite minimal. The second week after chemo, I'd feel a bit hungover, I would describe it. But week 3, I felt fabulous. And week 3 after your first chemo, I think you start to appreciate how poorly you were before it all started, because I was aware I felt so much better than I did before I started treatment.
Week 3 is the week that you plan things, don't you?
Yeah. And also, I don't know about you, I had ascites, so the swelling in your tummy, the liquid, and at the end of that first week after the first chemo, it just went. And you really have that sense of this is really doing something, it's making a difference in your body. And I think chemotherapy has moved on so much. You know, what we're talking about is an experience of it from 20, 30 years ago. And now they've got so many drugs to counteract any side effects you might have that you've got this whole arsenal of things.
That's true actually. The second chemo I had a reaction. And my son was with me, and he was the one who knew, because you don't get that many chemo nurses looking after so many, and they're working very hard, so they're trying to keep an eye on every patient. But Ryan noticed I was going all red and in a lot of discomfort. My chest was tightening up, so he rushed and got the chemo, and all the staff came and reversed everything that was going on.
I had a reaction to my last one, chemo 6, and exactly the same thing. Everyone came round. Immediately, within an hour, I was back to feeling completely great. And then there's a desensitisation protocol. So I came back the next day. They gave the same drug, but from a very small amount over a longer period. And it was absolutely fine. I was able to finish my course, have all of the treatment, and there was no problem at all.
How were you both prepared emotionally and practically for chemo?
So I think for me, the biggest thing was knowing that I was going to lose my hair. So I had, my hair was practically down to my bum. So it was always on top of my head anyway, so it always used to get on my nerves, but it was there. I got my hairdresser around and she cut it into a bob. And I think that was probably the most upset I was, because even though I'd had my hair cut before, it didn't feel like my choice, but I wanted to take control of the situation. So that's what I did, and I think that really helped when I started losing my hair from the literally 2 weeks after my first treatment. I think it helped that it wasn't so much hair coming out. And then I think decided to get the clippers out and take it all off. I just felt empowered and I felt good, and I actually felt less fragile, you know, from seeing all my hair coming out. So I think that was it emotionally for me.
I don't think I worried about hair loss. I was kind of waiting for it from like day one, and I hadn't appreciated it would be 2-3 weeks before it started to fall out. But exactly the same when it started to go. I had shorter hair, you know, much the length I have now, though without the chemo curls. And I got the clippers out and clipped it, and it felt like a really positive thing to do. And from that moment on, I just wore my hair naked or with a hat on because it's cold. Let's not underestimate how cold it is. Do make sure you've got something to cover your head with when that happens. And to the point where, you know, neighbours and friends weren't quite sure whether there was some, if they didn't know I had cancer, they weren't sure whether it was a sort of sartorial choice or whether there was actually something going on. And I think you can really own not having hair, but I get for everybody it's really different. For some people it's really traumatic losing their hair, and you've just got to do what feels right for you. Other than that, you know, just the practicalities of stuff in the bag to keep yourself occupied for 7-8 hours, be comfortable, have something to, you know, be warm enough. And again, that long cable for the mobile phone, because the chances are you're going to want to sit there and watch something or whatever, and being able to plug in and know you're not going to run out of battery is a good thing.
Yeah. What made both of you cope with chemotherapy between the cycles mentally?
So I think for me it was getting out, doing as much as I could. So it was going outside, getting fresh air, doing some walking, you know, just keeping active, because there are days where you don't feel like it or you're very sleepy, but when you can, doing what you can in order to just keep everything moving. That was really positive. Being clear about what I wanted as well. So there were days where actually I didn't really want to see lots of people, and so actually being clear about what you need. You know, actually today I'd rather people didn't visit, or actually today it would be great if someone came round and had a cup of tea with me.
I found it very hard to say, please don't call, please don't come in. You know, I found that very hard. I think I'm one of those people that doesn't know how to say
Struggles to say
yeah.
no.
Yeah, and then you feel the pain the next day.
I think, like, for me, weeks 2 and 3, emotionally, I would, you know, meet up with friends, I'd go for a coffee or go for a walk, and I think that really helped.
I said to all my friends, you're welcome to text or ring. If I don't feel like it, I won't answer the call. Don't take it personally. And I think that helped them to feel that they could approach me, and if I wasn't up to it, I just wouldn't respond. And there were a couple of times there were people around and I just fell asleep, and that was fine. You know, no one minded, they all understood I was in treatment. And actually I think friends feel quite nice about the fact that you feel relaxed.
Do that.
Yes.
I always knew from the day of my chemo for a week that I wouldn't really see anybody, because I felt generally good on the Thursday after the steroids, and then probably from Saturday to the Monday was when I didn't feel my best. I'd be tired and had a bit of nausea, so to help me I kept on top of all the tablets that they gave me. I made one mistake, I think it was cycle 3, I was out of sync and I didn't take my steroids and it threw me. So I would definitely say make sure you take your tablets that they give you at the time you're supposed to have them.
It seems like everything in the treatment bungs you up. Take the laxatives.
Yes, I religiously did that once I passed cycle 2. Take it 2 days before chemo, be prepared.
Or prune juice. I have prune juice. Make sure I take
that didn't
prune
work
juice.
for me.
Didn't it? Yeah, no, it works for me.
Prune juice, prunes, apricots, as much as you can to just keep everything moving. I've also done some physical training and tried to do things that are about enriching life. So I'm doing a pottery class. I would never have done that before. And I raided my rainy day fund because goodness knows it's been rainy. And, you know, bought a car I like.
Oh, nice.
Yeah.
Nice, well done you.
I think that's the thing, isn't it? Doing things that you just want to do and enjoy. And once I finish my last treatment, I'll probably look into some counselling.
Yes.
Because again, I think it's just very important to talk about your fears and your anxiety and get given those coping mechanisms.
Oh, I agree. I in some way I've found being out of treatment harder than being in treatment, because you've got that rhythm and you've got that support and security. And whilst you're seeing your oncologist still on a regular basis and you're having blood tests, etc., it feels different. And you've actually got time to sit and think about what's happened. Whereas I think in the in the hurry of treatment, you don't have that same time. And so that's when the emotional stuff kind of comes through. So actually having that support line, and I've had counselling and found that really helpful in deconstructing and actually thinking about what's happened.
Yeah.
And getting back to really living life, grabbing it by the throat and enjoying every moment of it.
Yeah.